John Muir Health, a not-for-profit, community-based organization, is known for excellence in patient care, and much of what we do is made possible through private financial support.
You know, the health plans are happy to pay for us to have robotic surgery, but they're not interested in helping pay for the fact that you have to educate the people, train the people, get the equipment, maintain the equipment at fabulous prices, and have a first-class operating room. The philanthropy is critical, or we can't have the healthcare people are looking for.
And it's that same great healthcare experience that often inspires people to give in the first place.
The care that I received after my surgery was amazing. It was just a wonderful experience. I just felt so well taken care of. And I thought, wow, that's really great. And if that's the treatment that everyone receives, I want to be involved with this facility.
As a little girl, I always wanted to be a nurse here. John Muir has been such a big part of my life. My children were born here, some of my siblings were born here, and I have worked here for a long time. So when I had the opportunity to give back, it was a pleasure to donate a small portion of my paycheck that I don't even notice, but know that it's going to a good cause.
My husband and I talked, and I said, I'd really like to let Dr. White know how much that meant to me and how important it was that his care to not just my mom, but to me, helped me get through the whole passage of my mom. I contacted him and I said we wanted to do something to honor both her and you, and was there something in mind within John Muir that you might like to see a small donation go to?
Losing a child is probably the hardest thing you ever have to go through. And people can go two directions. They can try to do something positive, or they can go to the dark side. And I didn't want to go to the dark side. We had to do something for him, do something for John Muir, do something for families, and to move it in a positive direction. And I think that's what kind of kept us going.
My wife made lots and lots of visits over a period of about 2 years. When she passed away, we wanted to do something that was somewhat permanent, not only to honor her, but to honor the nurses and everybody that took care of her. That's how we got introduced to the foundation.
The John Muir Health Foundation offers a team of experienced fundraising professionals who are trained to work with patients, families, foundations, and businesses to help them find appropriate and meaningful ways to contribute. They play the primary role in facilitating philanthropy for our healthcare system. However, as good as they are, they simply can't do it alone.
It's a team sport. Yeah, it's a team sport. Everybody is critical to the success of John Muir's fundraising.
I don't think as a caregiver, we really need to figure out, who can and who can't donate, or who might want to and who doesn't. But I think we can be aware of the cues, and when people ask the question, we can point them in the right direction.
Yeah, as the healthcare professional, you're not there to ask for money. You're there to care for the patients and to actually let them know what your vision is, your plans are.
There are definitely donors who've come back to the emergency department that have been very touched by their experience and want to give back. And I've had the opportunity to show those people around the emergency department and kind of give them a bigger understanding of what we do, because I feel like we're part of the community, and the community has every kind of reason and right to come in and see what we do and how we work.
I've had the good fortune of having taken care of a number of patients who've been very willing to donate out of their own initiative. Sharon came to me and said, these patients of yours have expressed an interest in making donations. And that was my entree into this whole world of fundraising.
It's definitely rewarding, but being passive and assuming that somebody else is going to take care of it is foolish. It's as much about being involved with how the hospital selects equipment, decides on policies, develops protocols. Making sure the philanthropy continues is very tied into it.
Together, we can ensure a vibrant future at John Muir Health and continue our legacy of excellence in patient care.